Alright, today we're going to discuss a little thing called the affordable health care. One of the questions that keeps coming up is, why are people's premiums rising? Okay, well here goes. First off, the ACA, or otherwise known as Obamacare, has basically set a series of standards. So that means that you're not going to only pay for yourself and what you're probably going to consume in terms of insurance, but you're also going to pay for pregnancy, you're going to pay for old people care, you're going to pay for long-term care. All these things rolled in together start increasing the price of health insurance very rapidly. So instead of paying, $150 for yourself a month, now you're going to be paying $300 a month for yourself because you're covering a whole bunch of other people. I mean, that's essentially what insurance is. So that's the first part of it. Now, the next part of it also, we have what we call a baseline. So all these things need to be covered. So they all cost money. It's sort of similar to something like minimum wage, where if I hire somebody, I have to pay them $7.50 an hour. That means that I have to recoup $7.50 an hour regardless of whatever else happens. That means that I'm going to charge, any of my products are basically going to cost $7.50 or more, so that I can pay at least this person. If I sell one thing an hour, I can pay this person. So you always kind of put a floor into place of how much things are going to cost, which is it'd be similar to the way we buy cars nowadays. So for instance, let's say that I want to buy a car, and I don't want to have seat belts, I don't want to have airbags, I don't want to have safety crumple zones, things like that. Okay, how much would a car like that cost? Probably not that much. But now all of a sudden the government mandates that all these things are included. So instead of a car that might have cost $5,000, now we're looking at a car that's going to cost $8,000, $9,000, $10,000 because of all the safety and all the other regulations that it has to meet. So it is one way that health insurance prices just go up, is essentially because of that. It also, the reason why it's going to go up is it's similar to our college loans. What we're seeing is that, let's say that you apply for FAFSA, and most people are going to get $2,000 to $4,000 a year to pay for their school loans. Well, the college most likely is not going to charge $2,000 when you would probably get $4,000 in student loans. No, they're going to charge you $4,000 so that they get the full amount. Okay, so it's the same thing going to be for health insurance. Health insurance companies are out to make a profit, so they're not just going to leave you, with a subsidy that will give you $150 a month. They're going to charge you $150 a month at a minimum because of the loans, and they know that. So this leaves us, with a couple of questions. Well, what can we do about this? How can we drive down the cost of health insurance, health care? The most straightforward thing, there's only really two solutions to all this. The most straightforward thing is, one is either the government takes over the whole healthcare the whole healthcare industry, which is probably what's going to happen here in the next couple of years, because it's the only way for them to be able to make good on all their promises. The other side of it is, or we basically just put it back down into the private markets. We withdraw all government controls, with them having a little bit of, say, like Social Security or Medicare, things like that. Just a small amount of money that they pump into things, but they get out of it altogether to drive down prices. One of the two is going to happen. Most likely, it's going to be government taking over of the whole system. All right, have a good day.